Good morning, friends. Welcome to a new topic. When the entire medical ward got panicky. Why? Because we had a patient who was about 40 years male. He was doctor by profession. He was qualified MBBS, a general practitioner. Friends, our general practitioners do marvelous job. They treat minor ailments like cuts or wounds, boils, drain carbuncles, drain pus from the pockets, and of course they do the stitching also. They treat typhoid fever, they treat tuberculosis, they treat even heart attacks. They are hesitant in referring the case to the specialist. But still I say their place is unique because every patient cannot afford to go to this specialist, and therefore they are doing their job very well. This the patient is to decide whether he is to go to the specialist or he can afford to go to the specialist. Friends, this doctor when admitted with us had moderately high grade fever. He had aches and pains all over the body. He described them as if his bones are breaking. This was severe pain. We admitted him, and 2 days later he developed rash all over his body. This was morbilliform rash. You have seen in measles this type of rash. I want to show for those who are not doctors. See this diagram. I am bringing very close to the screen so that you can stop the video and look at the rash. This is called papilliform papular rash. This rash is of the size of pinhead red spots. It is quite widespread, and these rash they become confluent, forming large red areas. This disease, so-called dengue fever, I will take a little time to tell that dengue, we pronounce it as dengue, but actually its pronunciation is dengue fever. So the correct pronunciation of this disease is dengue fever. So friends, dengue fever is caused by a virus. There are 4 species of this virus which are available. Now the infection with one virus causes lifelong immunity, but it provides only partial or incomplete immunity against the other serotypes. So if one gets infection in one season with one virus, and in next season he gets infection with another virus, his chances of getting complications increase. So this patient on the 4th or 5th day started having excruciating headache, which startled everybody because in such cases bleeding can occur inside the brain and there is no way to stop it unless it stops spontaneously. We kept a close watch on the patient. We gave him measured amounts of fluids and round the clock looked after by putting ourselves on duties. Ultimately, we were lucky that patient survived, but not after he had put everybody on alert in the ward. Now, we know that dengue is a mosquito-borne disease. Its virus is spread by the mosquito, and you know this mosquito is Aedes aegypti. Once again, you can have a look on the mosquito. This is the Aedes aegypti mosquito. This is different than Anopheles mosquito, which spreads malaria. This mosquito, Aedes aegypti, this spreads the dengue fever. Now, what then happened after that? The disease is quite common in tropical and subtropical regions. The most serious disease is the dengue hemorrhagic fever, also called dengue shock syndrome. It was recognized in 1950s during the dengue epidemics in Philippines and Thailand, and now it occurs in most of the Asian countries, and this becomes a major cause of hospitalization, especially in children. As I said, there are 4 distinct varieties of dengue virus, and a recovery from one gives complete immunity, lifelong immunity, but not from other species. During epidemics, attack rates amongst susceptible individuals, they are often about 40 to 50% and may reach even 80 to 90%. Now, without proper treatment, deaths in dengue hemorrhagic fever occur in more than 20% of patients. With modern supportive therapy, the death rate has been reduced. The mosquito harbors and breeds in water. It is the fresh water, like in tires, in coconut, in your pots kept in the rooms. All these are the places where it breeds. Dengue fever is more common in females, and some other malnourished people are protected against dengue fever. The reason is not known. Now, if a person suffers from dengue fever with one species, he gets lifelong immunity against it, but only partial or weak immunity against the other species. In total, one can have 4 attacks of dengue fever, because there are 4 species which are causing disease. A fall in systolic blood pressure below 90 is a bad sign. Similarly, a decrease in pulse pressure of 20 millimeter or more is again a bad sign. A high fever of acute onset with retroorbital pain, severe aches and pains are the predominant features of the disease. Please remember, whenever a patient with high fever comes to you, do ask him, does he feel pain at the back of the eyes, inside the back of the eyes? That is called retroorbital pain, and these patients do complain on moving the eyes, they feel pain at the back of the eye. That should be very suggestive of dengue fever. Now, there may be bleeding from the nose, from the gums, and from the gastrointestinal tract. The black tarry stools are another bad sign for these patients. Now, what is tourniquet test? Now, if you record the blood pressure of these patients, systolic and diastolic, and then raise the pressure to midway between the systolic and diastolic. I made it clear by example that let us say that our patient has a blood pressure of 120 by 80. So midway between the two is 100 millimeter of mercury. Simple to calculate. 120 plus 80, 200 divided by 2 is 100. So midway between 120 and 80 is the 100. Raise the pressure in the cuff up to 100 millimeter of mercury. Keep it for 5 minutes, and then count the Panicky below the cuff. Now, if there are more than 20 Panicky in 1 square inch below the cuff, it is a clear-cut case of dengue fever with serious consequences. If there is less than 10 Panicky in the 1 square inch, then its test is negative. But between 11 to 19, this is a borderline case. So then the other serious features are restlessness, black tarry stools, high grade fever. TLC to begin with is normal, but later on it becomes decreased. An important feature is hematocrit. Hematocrit, you know, it also called packed cell volume. You measure the packed cell volume, and if there is a fall of more than 20% in the packed cell volume, then the matter is serious. Now, for this you have to know the previous value of packed cell volume. Let us take example. Supposing the patient has a packed cell volume of 40 before developing the illness, and its 20% becomes 8. Now, if the patient's hematocrit is more than 48, then it is a serious case. But still, a better method is to have a ratio of hematocrit to hemoglobin. Let us again presume that patient's hematocrit is 45 and his hemoglobin is 15. The ratio becomes 3, and this is a safe case. Any ratio between 3.1 to 3.4 is serious, is normal. But if it is more than 3.4, it becomes serious. 3.1 to 3.3 is normal, is safe, and 3.4 and above, the ratio is bad. Say for example, somebody has a hematocrit of 50 and his hemoglobin is 14. Now 50 divided by 14 is definitely more. So it comes more than 3.6. This is a serious. What does it mean? It shows hemoconcentration. It means fluid has passed into these spaces in the body and the blood has become concentrated, and this patient has increased chances of bleeding as well as other episodes. Does the platelet count help? Yes, platelet count helps. You can do the platelet count. If it is your own laboratory and you have a provision to do it, you can make a smear, stain it with Leishman stain, and examine under ILA immersion. If there are clumps of platelets in your smear, then this is a sufficient number of significant normal count, what we will say normal platelet count. But if there are 2 to 10 platelets per ILA immersion field, then the number is sufficient, though it has decreased, but you don't have to worry about it. But if the number is 2 or less than 2 in per ILA immersion field, that becomes significant. That means the platelet count is below 20,000. So this is another rough way of making shortcut to the laboratory. But from the laboratory you can directly have the count. Another important thing which I want to tell you here is that do not panic from platelet count. Platelet count may be less, but if the patient is not bleeding from anywhere, like from nose, from gums, from the GIT or urinary tract, if he is even bleeding in the skin, if he is not having bleeding, keep a close watch on this thing. If he is not having bleeding from any of these things, then even platelet count, lower platelet count should not worry you. I have seen patients with platelet count going below 5,000 but without bleeding, and we did not give any platelets or blood transfusion to this patient, and after taking its time the recovery started, and count straightforward came to 20 to 40 and 80,000 when we discharge the patient. So friends, these are the type of difficult cases which I will be discussing in future also with you. I hope you will definitely subscribe the channel and of course like, and my request is that you give your comments. I am not finding sufficient comments, so I do not know who is reading or who is not reading. If you give a comment, even short comment, then I know that somebody has read my post, and you can also give your suggestions so that I can further help you. Thank you very much. Meet you with another topic next time.